My name is Dr. Sian Armstrong, and I'm a health psychologist and behaviour change expert. And the following presentation was developed in collaboration with the Change Exchange, THET, the Commonwealth Pharmacists Association, and other practitioner psychologists to give people an understanding of the role of people, behaviour, and behavioural science in antimicrobial stewardship. The following materials will introduce behavioural principles that you can apply in your own quality improvement work in antimicrobial stewardship. It will introduce the concept of behaviour change as a science and the relevant research, and allow you to understand why behaviour change is important in antimicrobial stewardship. The materials will then provide an example of a behavioural problem which you can use to facilitate group discussion in your own workplace. Behavioural science shows us that often knowledge is not enough to make sustainable changes. Often we know that things should be changed or could be different, but that doesn't always lead to action, which is where behavioural science comes in. Behavioural science is essentially the keystone between what we know and what we do, and how we bridge the gap. So how can this help us in developing interventions in antimicrobial stewardship? So behavioural science can help us define a problem in behavioural terms, often what is happening or not happening rather than what we know. It allows us to adopt theory-driven systematic approach to intervention design. It allows us to understand the implementation of interventions and the sustainability of any interventions in practice. And it allows us to maximise learning through detailed intervention reporting and outputs. Just because we can do something or know we can do something differently doesn't mean we will. And that's why behavioural science is so important in antimicrobial stewardship. We often know things should or can be different, but that doesn't always translate to change. To provide some everyday examples of the idea that just because we know we should be doing something differently doesn't mean we will, we can look at our everyday lives. Just because we know that we should exercise more, drink less, or eat less junk food doesn't mean that we always do. People always know that they should cut down smoking or stop smoking. That doesn't mean that it's easy to do or that it leads to change if they think about it. Furthermore, things like taking your medication on time or remembering to take them, or staying up late or getting enough sleep. People often know that they can do things differently, but as mentioned, that doesn't always translate into change, and that's why behavioural science and thinking about behaviour is so important. If we look at the theory of behaviour and behaviour change, the ComBe model allows us to understand what influences our behaviour and our decision making in everyday life and in decisions at work. Essentially suggests that behaviour is influenced by three main elements: capability, motivation, and opportunity. And our behaviour can influence these things as well. So to break it down further, capability is essentially whether we know how to do something or whether we're able to do something. Motivation refers to whether we think something is important for us to do or useful for us to do or not. And opportunity is whether it's possible for us to do something or for us to not do something in the environment that we are in or work in. As mentioned, behaviour can be influenced by capability, motivation, and opportunity. If we look at these further, it allows us to understand the individual and separate influences for our behaviour, although usually there are more than one influences for any behaviour. If we break capability down, we can separate this into psychological and physical capability. Psychological capability refers to whether we know how to do something or whether we have the skills to perform some behaviour. In the context of pharmacy, this can refer to something like whether we know the guideline for a certain prescription, or whether we know how to deliver a vaccine correctly. Otherwise, physical capability refers to our strength or height that might get in the way of performing a certain behaviour. That's less relevant in healthcare decision making, but might still play a role. Then if we look at motivation, which can influence our behaviour, this can be broken down into reflective and automatic motivation. It encompasses our internal processes that allow us to make decisions. Reflective motivation is essentially whether we think something is a good idea. We've thought about it and therefore have decided to do something or not do something. It encompasses our thoughts, our feelings, and any beliefs about a certain behaviour. In the context of pharmacy, this might be something like prescribing a longer course of antibiotics because we're scared about our patients going out into the world and developing a further infection. On the other hand, if we look at automatic motivation, this refers to things or decisions that we make subconsciously, so things that we maybe do without thinking, are automatic behavioural patterns. This is something that we don't necessarily reflect on, or something we do because that's the way it's always been. In the context of pharmacy, this might be something like prescribing the same course of antibiotics for pneumonia, even though the guidelines have changed, because it's just something you do automatically and don't think about. Then if we look at opportunity, this can be broken down into social opportunity and physical opportunity. Social opportunity refers to the influence of others, the people around us that have an impact on the decisions we make. This can be something like the social context that we work in, cultural contexts, social norms, government policy, that all have an influence on the social context that we work within. They might also be influenced by patients' beliefs or decisions, colleagues' beliefs about or decisions, or the thoughts of family members that could all influence your behaviour. In the context of pharmacy, this could be something like a patient believing IV antibiotics are better for them and requesting this as a healthcare plan. Then if we look at physical opportunity, this refers to whether your environment allows you to make decisions or hinders you from making decisions. For example, this could relate to how much time you have in the environment you work in, or the resources you have, or the context in which you work. In the context of pharmacy, this might be something like you wish to prescribe a certain medication, but it's not been ordered in and there's not enough stock, so you have to choose something differently. And then that affects your decision making and your behaviour. So as mentioned, each of these elements can influence our behaviour and the decisions we make about prescribing and patient care. So whether we know how to do something, our psychological capability, whether we've thought about something or believed something about our decisions and our reflective motivation, whether we do something automatically or have a habit of doing something one way, our automatic motivation, whether the context of the people that we work within or around have any influence on our decision making, of social opportunity, or whether our resources such as our time and things we have available to us affect our decision making in physical opportunity. Once you understand the influences on people's behaviour in your context, what influences prescribing decisions in antimicrobial prescribing, you can use these influences to make changes. So once you understand what capability people have, what motivation people have, and what opportunity people have to make changes, you can use these to do something differently or make a change in your context. Now, there are a number of different ways of doing this, a number of different ways of developing intervention to help us make change, but these are just some examples. For example, if people are struggling with capability, aka what they know or what they don't know, you can provide instructions or guidelines on how to do something differently. If people are struggling with reflective motivation, such as if they don't value change or don't believe something would be important, you can allow them to look into the future or look at the pros and cons of change, allowing them to reflect on what would happen if they did do something differently. If the issue is one of motivation that's automatic, for example, people doing things just because they've always done something, you can implement things like monitoring, so looking back on what they've done to understand it a bit further and do it less automatically. You can put plans in place so that if something happens, they have a plan for it rather than doing things just because they have done in the past. And you can also provide social support if there's a difficulty in the social context in terms of making change, or support planning through physical resources such as time. As mentioned, these are just some examples of the way that interventions can be mapped to the influences on our behaviour, but essentially once we understand what the influences are, this can help us make change. Separately, you'll be provided a scenario and some facilitator materials to allow you to work through a behavioural problem and think about it using the influences explained by the CwPAMS model in your own context. This presentation has provided an overview to the CwPAMS model and allowed us to start to understand some of the common behavioural influences on our decision making in prescribing in antimicrobial stewardship. It's given you a bit of an overview to the influences of people and behaviour and allowed us to start to think about antimicrobial stewardship from a behavioural perspective. To learn more about this, there is a new Introduction to Behaviour Change module on the Commonwealth Pharmacists CPD website. In addition to that, there are other resources on the UCL website that provide behaviour change techniques and interventions mapped to those techniques, as well as further informational videos on the Change Exchange website available through the links. In summary, what we want to start to do is think about antimicrobial stewardship from a behavioural perspective. So rather, it's not what we know or what we need to learn or what new guidelines we want to put in place, although those are important. It's also what influences our decision in terms of prescribing or not prescribing, in terms of the people and the situations in which we work. The presentation has allowed us to look at understanding behaviour change as a science, understand why we need behaviour change in antimicrobial prescribing, and provided an example of a facilitated group work example so that we can start to look at it together in our own working contexts. Thank you for listening.